So, what are some of the ways that your program has been able to integrate that responsiveness and integrate substance use services into your program?
We started with doing away with any kinds of intake questions in any of our processes that asked people specifically if they are partaking in, I don't even remember how we used to word it. It was very accusatory. Are you using drugs and do you need help to stop? That was how it, that's kind of 1996, like what we had grandfathered in. And even though if someone answered that question, we weren't necessarily like judging them that they were bad, you can hear how the connotation in the question is accusatory, and the following response is automatically, well, you need to stop, and we're sure you want to stop. So how do we do that? There's an expectation in the question. And so we moved a lot of our intake processes away from how do we help you stop using drugs if you are? And by the way, you can't stay here if you answer yes, but we're not going to tell you that till after you answer the question. Two, hey, do you have a safety concern? Do you meet our shelter screening requirements for basically a physical safety that's self-identified? Or if we have bed space, other types of abuse that you need refuge from. And that's the bar. And then when they would come in and we do a little bit more and they'd get to know the advocate they're going to be working with one-on-one so that this information isn't being passed from staff to staff, we reworded the question in order to understand how we can better support individuals to say, we want to talk a little bit about what our community living guidelines are here. We switched to, we don't call them rules and regulations. It's safety guidelines so that we can all live harmoniously. And so we say, when we have that conversation with individuals, we say, there are a lot of, I think I could even send it to you and you can pull it up while I'm talking, but the wording says there are many individuals who have experienced trauma or difficult life situations, or for reasons of their own, that use substances as a way to cope, or as something that we don't have any right to know what your reason is for it, right? And so we as a program don't have any requirements about what you have to not do or do in regards to substances. We just have one rule that you can't bring any harmful materials inside the building. And so then we talk about, if you want to talk with us about that you are using, heroin and you have track marks up your arm and it looks like you might have an infection and we want to get you some medical care for that, awesome. If you don't, we're not going to ask you about it, but we're going to make sure you understand where our boundary is, and it's that you can't bring it in the shelter. If you want to have a conversation about how that's not going to work for you because you need a safe space to be able to use, because we understand that experiencing trauma and also trying to get clean at the same time are not very mutually exclusive or sometimes reasonable or safe. And so we need to provide or find another safe option so that you can still do what you need to do and not have that coping mechanism ripped away from you, and maintain a safe environment at the shelter where we have kids. And so most of the time, they're really forthcoming about saying, hey, no one's ever asked me that question like that before. So you're telling me I'm not going to get kicked out if I tell you that I use meth? And we're like, no, absolutely not. You're not going to get kicked out. You can absolutely use substances or partake in substance and stay at our shelter. And it was kind of a freeing thing for the staff, because we have people that would come and be like, I know they're on drugs. Like, I know this person is on drugs because of their behavior. And I would say, okay, so tell me about their behavior. Well, they're cleaning our kitchen a lot. And they just can't seem to sit still. And I would be like, wow, so our kitchen is super clean. And they're like, but the way it got cleaned, doesn't that make you feel dirty? And it's like, no, it doesn't. It's not harming me. It's not harming anyone else in the house. And it's something that they're doing that is not, sorry, everything has to ring at the same time. It's not something that they're doing that's affecting anybody else in the house. Now, if they are, let's say, using meth and they're walking into your room and cleaning it and it's not their room, then we can set a boundary that has nothing to do with the drug use and say, hey, you know what? we have some really respectful boundaries to make sure that everyone feels safe in their own environment and living space. So if you're not staying in that room, we ask that you don't go into that room for lots of reasons, right? We wouldn't want anyone coming in to disturb your space, or dealing with any kind of theft or breaking anything, or just making someone feel unsafe. And we can explain it without having to say, you're on meth and we're scared of you, so please don't go around other people. And so the behavior stuff, it really ignites that people are on, they say that they're using things, but when you talk to them about why that makes them nervous, they can't really explain it. Heroin is another one that we hear. They've got track marks, and their pupils are this or this or that, and like, I've seen heroin and I know what it is. And the individual that's on heroin they've been sleeping for 12 hours, and I'm like, okay, are they sleeping in your bed? No. Sweet, we should let them sleep. Maybe they're tired. What have you got going on today? And it's amazing how they're like, I can't come up with something that connects why this harms me. And if they come and say, hey, my roommate is shooting up on her bed and her heroin's laid out on the dresser, that's something that I would come and say, if you're sharing a room with someone, we say that really explicitly that you can't have that stuff here. So can we have a conversation about where might be a safe place, or if we even have an option for that, and then safety plan about what that looks like? Because the individuals staying here have a right to not be propositioned for drugs or to use drugs if they aren't interested in that. And they also have a right to live in an environment free of it where they can't be harmed by it. But other than that, that's where it goes. We also have rules about, alcohol's legal. If you want to go it used to be that if they came back and we could smell alcohol in their breath, they had to leave. We kicked them out. And then we thought, like, when people are having a hard time and they want a glass of wine, like, why are we regulating that? We don't keep it in the house because our state licensure says we can't have alcohol on the property. But man, if our organization had like some lockers on the side of the building that I gave somebody a code to, and they wanted to put a bottle in there, that's up to them. I'm not going to go looking at it. And so we try to get really creative about those types of things. And even with our law enforcement partners, if we have paraphernalia that's dangerous, like needles, I don't think spoons are very dangerous unless they have something on them. But, mostly needles or anything with bodily fluids, we have means on the property to be able to dispose of that in sharps containers or biohazard containers and take those to appropriate places without having to have someone come pick it up and take it somewhere like we used to have. We don't have to tell anybody about that. We don't have to involve anybody that doesn't need to know. And so it has really increased our ability, because they'll tell other individuals in their lives who are inevitably being taken advantage of in a space because they know they can weaponize that substance use, to say, hey, this place is safe, and they're not going to tell you that you can't drink, or that you can't smoke, or that you can't do those things. We just have healthy boundaries around where it's appropriate to do them and where it isn't. And it's worked for us. And in my wildest dreams, I would love to have a part of our program that focuses on a safe use site, that we have somewhere on site where they could do that, or where they could, if they came back and were especially drunk and couldn't walk up the stairs, or were maybe a little bit belligerent, they could have somewhere to sleep that off that was safe and away from other people. Because we know people aren't utilizing substances. I hate the word like recreational drug use, because I feel like nobody just like sits down to like a needle full of heroin one day and is like, this is going to be a lot of fun. Like, I'm really excited about this. They may have lots of things that lead them to get to that point that were based on fun. But I think that there's just so much more complexity to that. And so when we treat it as a complex thing and not a complex issue, that we can't understand everything about it and we don't have a right to their story about their substance use, then they're much more reasonable to talk to us. And the other thing that's come out of that we realized we needed was people were becoming very open about what they're experiencing, and what they're using. And we would have them come to our office and say, I really need to use tonight, and or I have a habit of when I get really, really upset that I sometimes use too much, and I've overdosed in the past, and I'm really nervous about this happening to me. But I know that I'm not going to just not use, but I want to talk about, I want someone to know in case something happens. And then we're there saying like, oh, you know what? We keep naloxone here on site. Can we give you some? Can we talk with whoever you're going out with tonight and show them how to use it if you're nervous about that happening? Can we, can we call you and check in on how you're doing? Coming up with a safety plan around what that use is and measures to protect that individual. If they have a sponsor, if they have someone, if they're going to go use, do you have someone that you're going to use with? Do you have someone that you can call, that if you're going to use together, you feel really safe with, and you feel like you can keep an eye on each other? And a lot of times they haven't necessarily thought through that piece of it as safety, other than I just want to be around someone. And a lot of times with certain drugs, it's been, I want to drink alone, or I want to use alone so that I can escape from whatever is going on. And if we have someone who they identify they can call, and they have our number too, then we can intervene if something ever got out of hand. And we have done that on numerous occasions. And I can tell you, since implementing some of these changes, and I'm ashamed to say some of them even in the last 5 years, and I wish it was sooner, we have had less instances of finding harmful substances or needles or bodily fluids or overdoses at our facility, because they're not going out of their way to hide it from people and doing it in unsafe circumstances. It's like they can rely on us to not have any judgment and talk with them about how to stay safe. So those are some things that we've done at our agency, and it's still not perfect, but it was a start, and it was scary. It was a super scary start, but it has really paid off. Sorry, I'm very long-winded.
No, it's been so great to hear like where you started and then what that has looked like in the process, right? And how it's how really being able to approach things without that stigma, with really just a matter of fact, and then through that creating an environment of safety. And that on the other side of that, despite, some of the fears, right? Whenever we were trying something new, there's fears, a really natural part of that. But now being on the other side of that, seeing how actually it's been such a huge help for supporting safety for survivors and for the program.
Something, and I will say this additionally, something that was really empowering recently is Utah passed a very strange medical marijuana bill a couple of years ago. But we do have some version of it operating now and today, and we have some dispensaries in the state, which is great. But something before included in our licensure was, oh, you also can't have weed on the property because it's an illegal substance, right? So I'd have to be like, walk out to the gate, we're going to watch you on the camera while you smoke, or someone can come walk outside with you that stays on the property to make sure nothing happens and you're okay. The super awesome thing that's happened because of the change in marijuana laws here or I guess cannabis is what they have said, is that now we're able to be even more inclusive of that, to say, now it's not an illegal substance in these types of settings. And so, yes, you can keep it in your locker. You don't have to leave and go get it when you need it. You can keep it in your locker. You can smoke it on the smoking patio. You can cook it into something, as long as, you tell us and don't leave it unattended and someone gets into it. Most people aren't doing that. It's very valuable to them and it's a lot of money. So we don't have a lot of problems with that. And other people, that really blows my mind. Other people think they're just going to leave their meth like laying around for people to just like step into or something. And I'm like, I don't think you understand this. Let me talk you through it just a little bit. But So it's been really cool to be able to incorporate marijuana into saying this is something that you don't have to like hide here, and that we've been able to change. And our staff, for a minute, for the organization, it was a little bit like maybe we should wait and see how things play out before we make any changes. And we made a decision as leadership that says if the legislature has made that decision and we have the code and the law that's written, we're going to take that and we're going to work our policy around that. Because if we get into any kind of trouble because our licensure hasn't caught up, or law enforcement stops by and they haven't caught up with training, we have law we can stand behind to say we're following what our legislature has written and we're not breaking any laws. And so that was really neat to be able to kind of incorporate that into being more welcoming of individuals using cannabis in our facility. Not in our facility, like outside on our smoking patio facility.
Yeah, people who are staying with you and also
Yeah.
using cannabis, but not in your facility.
Right, right. I'm like, you can't smoke in the shelter, but you can definitely chew gummies and do those types of things as long as you're not attacking someone else. And this was a big fear for a lot of other clients. Like if they're on drugs, like I'm in danger, especially marijuana. People are really afraid of marijuana in Utah. But I've had to tell a lot of people, I have never, ever come across someone who has been violent on marijuana. I'm sure it's happened somewhere, but I haven't had that experience. Usually I'm just buying more groceries and existing in some circular conversations, and they're very kind. And that's my experience. But if my experiences change, then I'll let you know. And so it's just a very interesting and kind of freeing experience to really like peel the like secretness off of drugs. And it's been great for moms with teens in our shelter because some of them have figured out their kids were using substances by seeing behaviors of other individuals and being able to have a conversation with them about it because they were just very oblivious to it. And so that's been interesting to navigate as well, but it's really created a support system to help them navigate those relationships and those concerns. So all sorts of things. Swore by it. Love this kind of stuff.
Wow, that's something I hadn't even considered.